So, similar thought process for genu valgum deformity. When I see a patient with genu valgus deformity, I will draw a Serenus curve, explain to the examiner that till the child is born, it has a varus curvature. 18 months, it becomes 0. In 3 months, it becomes more valgus exaggerated to 10 degrees, and then it reduces to 7 degree of valgus. So any child who being a valgus deformity at the age of 2 to 3 would you manage deemed to be physiological. A physiological deformity is not painful, it is bilateral, and it has no stiffness and asymptomatic. While vice versa, on the opposite side, it will be pathological. So when I assess the patient, I will examine the patient by having a good gait. After gait examination, I would check for the distance between the measure the intermellular distance. More than 8 centimeter is terms as pathological. I will check for etiologies, which can be trauma, infection, tumor, dysplasias, or a previous history of fracture with a Cozen phenomena. I will bend the knees up till 9 degree and check if the deformity is correctable. If it's not correctable, it's from the tibia. If it's correctable, it's from the femur. After assessment, I will decide what type of after the examination, I will check investigations, which is radiological in a form of X-ray, which is weight bearing, standing X-rays, and biochemical tests to exclude the problems like infection or any history of rickets itself, which consists of vitamin of alkaline phosphatase, vitamin D, PTH, and thyroid. If the deformity is bilateral, or if it is in a younger population, my thought process is less than 3 to 4 years, I can do bracing. I know that bracing is ineffective, but it reduces the chance of progression itself. Otherwise, the treatment, operative intervention, if I plan, it will be hemiepiphysedesis. In a valgus deformity, the growth is from the medial side of the femur. So I'll place a 8 plate or a staples or do a fusion of the medial physis. I plan to operate on the child if it's less than 10 years in a form of hemiepiphysedesis to allow the growth and correction. If he's more than 10 years old, I will plan to decide for an osteotomy.